Thank you so much, Greg, and thanks for that really wonderful overview and introduction. So I'm really thrilled to be here today to talk about some of the work that we've been doing looking at the impacts of climate change on health and well-being, particularly in vulnerable communities. As Greg mentioned, I'm an assistant professor in the Environmental Health Department at BUSPH. Next slide, please. So one of the things that I want to highlight, going back to the figure that Greg showed a couple of slides ago, is that much is known about the physical impacts of climate change, including particularly the relationship between increasing ambient temperature on physical health. And in fact, our group has been involved in some really excellent research to look at the impact of increasing ambient temperature on health across the life course. So for example, we have a recent paper that came out a few months ago in the British Medical Journal that looked at the relationship between increasing summertime ambient temperatures and health across a spectrum of health endpoints. And again, a couple of days ago, another paper that was put out by some colleagues in our department, including Greg and others, that looks at the relationship between ambient temperature and hospitalizations among children, which showed that there is an increase in the risk of hospitalizations among young children as well. So there is a lot of previous research and ongoing work on the relationship between temperature and physical health, but I think relatively less is known about the impact of increasing temperatures and other climate-related extremes on mental health and well-being. And there's a lot of challenges to looking at the relationship between climate and mental health, including, a difficulty in accessing the correct health endpoints that are of interest. So some of our recent research aims to understand the mental health impacts of increasing temperatures. Next slide, please. And the way that we're doing this is utilizing data that we have from the Optum Labs data warehouse, which is insurance beneficiaries across the United States, including commercial insurance, as well as some Medicare Advantage beneficiaries. And what we've been able to do is compile a data set that has approximately 3.5 million emergency department visits between 2010 and 2019 across the entire US, aggregated at the county level. And we've combined that with data that we have from PRISM, which provides us with estimates of ambient temperature during summertime periods, to look at the relationship between ambient temperature and emergency department visits for mental health. Next slide, please. And what I want to highlight here, sorry, I guess the figure on the left is a little bit difficult to see and may have cut off, but what we see is that for all mental health endpoints combined, we do see an increase in the relative risk of emergency department visits, or the incidence rate of emergency department visits within this data set associated with increasing ambient temperature. And this is true not just for the composite of all mental health outcomes that are indicated in this data set, but it's also similarly true for each of the different specific causes of mental health. So for example, on the right, you can see that there is an increasing association of emergency department visits with ambient temperature for example, substance use disorders, anxiety, stress, and somatoform disorders, mood disorders, schizophrenia, self-harm, and childhood onset emotional and behavioral disorders. And this is really interesting because we see that these increases are fairly monotonic as temperatures increase. And additionally, we do see that they're the same across all of these different conditions. So we could think of temperature as being an exogenous stressor that creates problems for underlying ill health. So I just wanted to highlight some of these relationships. And next slide, please. And I just want to mention that what's next is to look across several different types of extreme weather events. So we might see co-occurring increasing temperatures with things like hurricanes. We have data on these exposures as shown in the figure on the right. And so the idea is to look at not just temperature, but more holistically across different types of climate relevant exposures. And with that, I think I've gone a little bit over my time, so I'll turn it over to my colleague, Amelia Westlink.